Ah, the knee. When it works, it's beautiful. Watch Barkley. This is 2020, Giants versus Bears. Watch the right knee right there. Okay, knees aren't designed as uniaxial or hinge joints. And when we look at the structure, we can see that, yeah, one direction. Now, looking at these images, it gets confusing. So I went ahead and sketched it because I know there's four bones. There's the upper femur, or thigh bone. There's the tibia down below, shin bone. On the side, the fibula on the lateral side, and the kneecap or patella. And so my challenge, if I'm going to build the perfect knee, I want to have some lateral movement control, and that's what the collaterals are all about. We have a lateral on the outside, also called the fibular, and it's going to tie the femur with the fibula nice and snugly so we don't have a lot of side-to-side motion. Now if we have a lateral, we need a medial too. Now there's two names because depending on where you got your training, so we got to learn them both. Tibial comes from the tibia down to the fibula. Collateral ligaments. Okay, so we've controlled the side-to-side motion, but now we have to think about what about when the knee does twist, and that's what we have the cruciates for. There is a anterior or ACL cruciate, which is the one you'll see from the anterior aspect. Its job, and then you get a little peek of the posterior. Its job is to reduce twisting. So if we want to take a better look at that, the anterior coming across from the anterior aspect, I'm looking down on the top of the tibia, and the posterior or PCL coming across. Now their job is to protect us when there is a twist, because it's going to happen, right? Our knees are going to twist even though the knee is not designed for that. Now what I like is there's also these pillows called menisci, or singular is meniscus. And these are going to keep the bones of the femur and the tibia from rubbing together. And you might think, well, why don't we have a complete band of meniscus? Why do we just have these little horseshoe-shaped ones? Well, part of that is because before we do something active with our knee, we need to warm up. And as we warm up, the capsule is going to release synovial fluid. It's like motor oil. It's a lubricant which increases the protection we're going to have. So you always need to warm up. All right, I know it's sometimes boring. Now we're not done with the story because we still have to tie in some muscles, because this is the base layer for stability. But what about the power and the strength? That's going to come from the quadricep muscle. So I'm talking about rectus femoris, vastus lateralis, medialis, the huge muscles of the upper thigh. They need a place to grab onto, and that is right here on the superior aspect of the kneecap or patella. So that's the quadricep tendon. Now we can't just have one tendon because we need a balance of power. So on the inferior aspect, we have the patellar ligament tying into this roughened tuberosity on the tibia. All right. And finally, on the back of the leg, we need some way to get the hamstrings, such as the bicep femoris, massive muscle on the back of the leg. It's going to grab hold of the fibula. It's kind of hard. I'm going to try to go around back side of the collateral. So imagine this muscle going on the posterior or back of the leg, bicep femoris tendon. Now we have a knee that can withstand all sorts of tension. In fact, time and time again. Look at, here's Tiger Woods. Terrible knee injury, but in 2018, he came back to win the Masters. Amazing knee.